Kārtīgs prieks un gods, ka kopā ar mums šodien ir kāds īpašs viesis, un tā ir Eiropas farmaceitisko rūpniecību un asociācijas federācijas izpilddirektore Nathalie Moll. Ar aplausiem sagaidām viņu.
Labrit and good morning to everybody. Thank you very much for the invitation to join you today in Riga. It's really a great pleasure to be here, not only because you have a beautiful city and I was here 6 or 7 years ago, but also because this is an incredibly important moment for us at European level. We have a new mandate of the European Commission, a new European Parliament, and in the European project, every country has its important voice. Small countries as well as big countries. So for me, it's really important that you have this dialogue, this asking of questions, and hopefully finding some solutions as well. What I would like to focus on in my small intervention are two things. The objective of creating in Europe a real power house of life sciences, because we need this. And then I would like to address also access, because I know that in Latvia, access to medicines, as you just heard from Lina, is certainly still a challenge for which we need to find some solutions. But let's start with the broader picture. Why do I want to talk about life sciences? Because I'm a biotechnologist, but not only because of that. Because over the last 2 or 3 years since we had COVID, of course, there's been a lot of focus on medical innovation, but there's also been more recently in the last 2 meetings of the European heads of state in 2023 and 2024, a lot of focus on the need for Europe to have strong medical innovation, to be a powerhouse for life sciences, because more and more other parts of the world are equipping themselves. China has had a biotech strategy for the last 20 years. Every 5 years, a new biotech strategy. They have become extremely powerful. And the US also has put several things in place in order to attract innovation. So if Europe wants to be able to compete and to be autonomous, but also participate in that innovation trajectory, we need to make sure that we have the right policies. And recently, you probably saw this publication by Mario Draghi, an ex-Italian prime minister, focusing very much on competitiveness and pharma, giving some ideas, some solutions, some proposals to improve the situation. But more broadly, also the president of the European Commission put a life science strategy at the center of her next 5 years, looking to see how we can improve our innovation capital. And for us, as a pharmaceutical industry, we want to be part of that transition. Why is it important? Because the pharma industry is one of the biggest contributors to the EU economy. We are the biggest contributor to the EU trade balance. You might not know that than any other sector. And I think that this is something that not many people know. We also are the biggest contributor to research spending. So we represent 20% of all of Europe's research spending. We obviously employ many people, but what I'm trying to look at is the innovation capacity. And at the moment, this intense competition from the US and China is it's draining our brains, but also our companies. So we have lost, I was telling the minister this morning, we've lost 25% of international investments in pharma in the last 20 years. So this has been a steady decline. These investments have gone to the US and China. And to stop that decline and reverse it, we really need to put a series of coherent policies in place to make sure that we can attract the investments, that we can make sure that we transform our ideas into products and into services for the population. So this will be important not only because of innovation, but because of health security and economic security. We heard just now how important it is to make sure that people can continue to work. It's not only about continuing to work, it's being ready for any situation. And we have wars on several borders around us. We've had a pandemic, so we know that can happen. We want to make sure that we learn from what we went through and we are as ready as possible to face those things. So I mentioned it, what should we do? A strategy on life sciences sounds like a great idea, and it's fantastic to see the President of the Commission coming up with that. We have some ideas on how to fill that strategy. Certainly, we need to make sure that there are coherent policies. There's a lot of digital and green focus and something on pharma, and we forget sometimes that these things touch. They're not isolated. And so certainly at European level, we're calling for some coherence of policies, making sure perhaps there's an office for life sciences that looks at the strategy and makes sure that any other policy developed goes in the direction of supporting the strategy. There are some good examples not far from here in the Nordic countries. There are quite a few life science strategies, and maybe this is something that you could do also at Latvian level. It means having a few different ministries discussing life sciences and looking at what policies you need to make sure that life sciences can actually thrive in a region or in a country. I'm going to now talk about access. So this is the life science pitch, the future, what we need to do to build a resilient Europe that is innovative, that also has the solutions for the future. Access is today already. And we had a conversation this morning about access. As you may know, EFPIA produces every year our weight indicator, which when I joined EFPIA, I thought it was something to do with your weight, how much you weighed. No, it's not about weight. It's how long you wait for a medicine. And of course, it gives you very stark reality check on, as you heard, the number of products that have been approved at European level and the number of products that reach countries like that, Latvia. And it's not acceptable that because you were born in a country or because you live in a country, you do not have the same access as other countries. So as an industry, what we did after producing the weight indicator year after year, we realized we had to understand the root causes, really understand what are the problems, why is this happening, so that you can find solutions, a bit like you're doing today. And we discovered there are about 10 root causes, and they're very different. There are different health technology assessment requirements. There are different speeds of reimbursement agencies. There are different readiness of healthcare systems. There are different requirements, clinical trial adjustments, things that can delay access in a different way in each country. What does that mean? That there's not one actor who can find the solution. It's not the government who can give access, it's not the industry who can give access, it's everybody together that has to find solutions for every different country. And this is the challenge, of course, that you are also discussing, I'm sure, today. How can we set the framework in place to take some real steps forward in access? At European level, we have called for a dialogue between all the actors, the member states, the payers, the commission, the industry, the distributors, the hospitals, the patients. I've asked for it for 5 years. I'm not giving up, but it's difficult. You need to have that dialogue. If you can't have the dialogue, what else can you do? You can start with yourself. When you have a problem, you can start to see, okay, what can the industry do? So 2.5 years ago, the industry took a commitment to file for pricing and reimbursement in all 27 member states. And I learned today that Latvia is one of the highest countries in terms of that commitment, so that's really good. To file for pricing and reimbursement within 2 years of approval and to monitor that. So we have a portal, an online tool that checks, have the companies filed, where are the products? If they haven't filed, why haven't they filed? Why are we doing that? Because first of all, we want to increase the offer, but we also want to increase the transparency of where the problems are. If you have a tool that shows you the medicine is stuck here, then you can know this is where I need to act. So hopefully by the spring of next year, we will be able to have a very clear picture of what the access issues are per country. And then ideally, that picture we take to a round table where we all discuss how to fix it together. There are dynamics in a single market where products move. So we can't price medicines the way we would like to at the price that different countries can pay because the products move. How can we work together as a European Union in solidarity to make sure that each country gets the medicines they need at the prices they need? So this is the other side I would leave you with. So one is life science strategy for our future, make sure that Europe regains its position. We used to be the pharmacy of the world 50 years ago. I would just be happy if we were the life science ecosystem of the world, and on the other side work together on access immediately as a European Union, and Latvia has a role to play in that. You have issues and you can ask for a dialogue to find solutions like the one you're doing today. So thank you very much again, and I look forward to learning from you. Thank you.